So there's an unmistakable trend happening in medicine. Orthobiologics is no longer a side skill. It's no longer niche. It's becoming a distinct medical specialty, just like orthopedics, sports medicine, or PM&R. And as this specialty matures, one thing is becoming clear. The doctors who can perform high-level diagnostic ultrasound-guided procedures, diagnostic and ultrasound-guided procedures, those are going to be the ones who define the standard of care. This is not a weekend course ultrasound ready, not I can find a joint and do injections, but RMSK-level competency. The kind of training that proves that you understand anatomy, pathology, and gives you the ability to interpret at a diagnostic level. That's why AMSKU trains every clinician to be board-ready standard, because the future of orthobiologics is going to demand it. If the residency model program isn't right for you in the timing, that doesn't mean you should step off the path. It means you need to find the right entry point. So we have a couple of different options. Number one is our immersion program. Okay, this is a 2-day high-touch introduction to the future of the field. Our immersion weekends give you a hands-on, clinically relevant experience that mirrors the direction orthobiologics is heading. Okay, in these 2 days, you're going to learn a few things. Foundational scanning of all the 6 peripheral joints, shoulder, knee, and hip primarily being the big ones. Orthobiologic-relevant diagnostic frameworks. How to use ultrasound and be able to justify your orthobiologic recommendations. Immersion isn't just a teaser, it's a gateway into the specialty that's forming right now. Here's the truth. Doctors who can scan, even at a foundational level, are already being rewarded in the orthobiologic market. Our immersion weekend gives you that competitive edge immediately without requiring a full commitment to a big ticket program. Our online courses help you build the diagnostic literacy that the future of orthobiologics is going to demand. Okay, it gives you flexibility. Okay, build mental models that orthobiologics will soon expect as a baseline. You'll develop sono-anatomy fluency, region-specific diagnostic reasoning, optimization skills, foundational frameworks, the literacy needed to eventually train at the RMSK level. Okay, online courses don't replace hands-on mentorship, but they do ensure you're not standing still while the specialty evolves around you. In a field where precision matters, clinicians who understand what they're looking at and why, those are going to be the ones that lead the way. So, doctors, you're not choosing a program, you're choosing your position in a new specialty. Whether you choose the full residency model, an immersion weekend, the online courses, you're not just choosing a training pathway, you're choosing where you want to stand as orthobiologics becomes its own specialty. At AMSKU, we're building the clinicians who will define that specialty, the ones who can diagnose with clarity, treat with precision, and communicate the findings with authority in a way that patients can understand, okay? We don't lower standards. We simply offer multiple ways to begin the journey, because the real risk is not choosing the wrong program. The real risk is being underprepared when orthobiologics becomes formalized and the market is going to expect RMSK-level competency as the standard of care. If you're ready to lead the future of orthobiologics, the residency will take you all the way to RMSK-level mastery. If you need a stepping stone, the immersion course gives you a powerful hands-on preview of the skills that this emerging specialty is going to require. If you need more flexibility, our online courses will let you build the diagnostic foundation that will soon be non-negotiable in orthobiologic practice. So really, no matter where you want to start, the goal is the same. Become the doctor that the future specialty is going to reward. Skilled, confident, and diagnostically elite.